And I'm like, okay, well, I'm going to drive myself to the ER. Hope you're better. Whatever. And they're like, you have to deliver, whatever. Rick makes his way to the hospital. You better believe that man was wheeled in on a fucking wheelchair.
No way. Oh my God.
As I'm walking to go pee. This is where I get frustrated.
Don't even open that can of worms.
Like horrifying.
Horrifying. Not allowed to cry or have emotions in your house.
Like, do you really need to know what Zimoglyphosate is?
Oh, Jessica.
Everyone has a favorite. Everyone does. Hello, everybody. Today we are going to talk about postpartum health, specifically pelvic floor stuff, which I know nothing about. So I'm really excited about today. And we have a special guest, Lauren. You are friends. You've used her.
Yeah.
Go ahead and do a little intro.
Okay, so we have with us Dr. Sara Reardon, who is a pelvic floor physical therapist. She was actually my pelvic floor physical therapist pre-COVID. After I had my second child, was experiencing some things that I was like, what the hell is going on? I mean, TMI, sorry, don't care, but TMI. I was like, why is my tampon just falling out of my body? And it took me talking to a friend because, nobody talks about this stuff.
Yeah.
It took me talking to a friend and she was like, honey, like go see a physical therapist that specializes this, which I didn't even know was a thing. But I found Sara and she completely transformed my pelvis for me. And now she's famous. So I feel I feel so blessed that I was able to actually be her client before she became famous.
No. So thank you for the intro. And it was an honor to work with you as well.
With your pelvic floor.
With your pelvic floor. So I am, from New Orleans, born and raised, left for 17 years and then returned after 17 years of being away. And
where were you?
I was in college and grad school in St. Louis. I went to WashU in St. Louis. And then Katrina happened when I was in grad school. And hospitals were still functioning out of trailers. And so I didn't start my career there. And I knew I wanted to do pelvic floor therapy. So I moved to Austin for 2 years.
Oh, cool.
Started practicing there and had an amazing mentor in pelvic floor. And then moved to Dallas. I followed a boy, moved to Dallas. And then he and I split up and I was just about to move back to New Orleans and then I met my husband. So I was I followed a boy and then I met a man. And then, and then he and I convinced him to move back to New Orleans when we had our second kid. And I was like, it'll just be 2 years. He was working with Entergy at the time. And then it's 8 years later. And then here we are. So
here we are.
Thanks for having me.
Yes.
Yeah, we're so excited you're here.
Okay, so we always start with some stats, trends, and facts. And so we're going to talk about a few and then we'll hand it over. Okay, so Lauren, you start.
Yes. Okay, so 1 in 3 women experience some kind of pelvic floor disorder in their lifetime, which is huge. That's, 30%, over 30% of us. Some examples of this, which I'm sure we'll get into more, pelvic organ prolapse. So basically organs falling out of your vagina, bladder control problems, bowel control problems. I see this a lot in not just my patients who are postpartum, but also a lot of the older ladies that I see. Vaginal deliveries double the rate of pelvic floor disorders compared to C-section. I had 3 that I pushed out, so my pelvis took a beating. Postpartum pelvic care in the U.S. is very different than it is in other countries in the world that we should probably look to as examples for us. So pelvic floor physical therapy after childbirth could prevent a lot of unnecessary medical interventions later in life, like surgery or medications for urinary incontinence. And there are other countries that do a really good job of building this into postpartum care, like France. I know a lot of people have heard about how in France, this is just, you go to your 6-week visit, and if you're having any kind of urinary issues, pain during sex, et cetera, pelvic floor issues, they immediately refer you to a pelvic floor therapist. Whereas here in the U.S., we got to advocate for ourselves and go and find the pelvic floor therapist ourselves. So,
or even know what a pelvic floor is.
Correct.
You know?
Correct.
All right. So a couple more things. So maternal mental health stuff. Conditions are maternal mental health conditions are the most common complication of pregnancy and birth, affecting 800,000 families in the U.S. each year. More than a third of women experience lasting health problems after childbirth, including pain during sex. You said low back pain, incontinence. 1 in 3 birthing people report feeling traumatized by their childbirth experience, and approximately 17% will experience symptoms of post-traumatic stress. And then hemorrhage is one of the leading causes of pregnancy-related death. So today, I'm a C-section girl, okay? I had my first C-section was at 24 weeks, and that was my first pregnancy. And then my second one, this was like emergent, obviously. And then my second one was at 32 weeks C-section. And so, like, I was on your website, and I saw the C-section cliff, which
the shelf.
the shelf. Yeah, shelf. I don't know why I put cliff. That's so weird. Okay, well, I have the shelf. And so, what is it? And how does the pelvic floor, I don't know, how is that connected?
Also define pelvic floor.
Yeah, define pelvic floor.
That's what I was saying. So when I listen to y'all say these steps, I get goosebumps because it's sad. And it almost makes you think, why would anybody want to have a baby when you're telling us that this is the destiny, the cost of being a birthing mom in this country?
Yeah.
It feels pretty crappy, right?
Yeah.
And I think it's the analogy is often the baby's the candy and the wrapper gets thrown away, right? The mom is just kind of, and that's how it feels. And I think that a lot of the statistics you report are actually underrepresentations of what actually is occurring. So the pelvic floor is a basket of muscles that sit at the base of the pelvis. So we're all used to seeing those bones, we see them like skeleton jammies for kids, or if you're in the doctor's office, it's the ring of bones at the base of the spine on the anatomy model. And at the very bottom, there's an opening, and that opening is supported by what's called your pelvic floor. So your pelvic floor is literally the floor of your pelvis. It's layers of muscles and fascia and nerves and tissues. And those muscles support your pelvic organ. So your uterus, which holds a growing baby, your bladder, which holds urine, your balls, which hold poop, all rest inside of that hammock of muscles like a basket.
Okay.
And those muscles also have the openings for urine to exit through the urethra, the anal opening where poop exits, and then also the vagina for vaginal birth, vaginal intercourse, and menstruation. So the interesting thing is if anything's awry with peeing, pooping, sex, back pain, hip pain, support, your pelvic floor muscles are involved. And the way that the medical system is set up in the United States is that there's a doctor for your bladder, there's a doctor for your vagina. And there's nobody looking at the muscles that are related to all of these different functions. So I think that's why pelvic floor issues go really undiagnosed and undertreated for so many women.
I want to chime in real quick because this, especially when you say there's literally and I'm an auctioneer person, okay, and because whatever, we did NICU and all of the stuff, so my kid, all of the records, it's just easy. It's 1,000. Anyways, so but there is a fucking oh, he has heartburn. Well, you got to go to this specialist. There's not the bladder, the uterus, all that other stuff you said. To me, it's if you have to go to 85 different people for problems that could be resolved with one person who's looking at the whole picture. Why is everybody so selfish that why can't we all work together?
Yeah.
And treat people. Yeah. Right. Okay. Go on.
No, so you bring up a great point, and I think that pelvic floor therapy has been a last resort treatment option. So even in Lauren's case, it's she had to have the courage to talk to her friend, and then the ability to go kind of investigate what she was looking for, and then the resources to schedule an appointment. And I remember it'd be okay, I've got to run to go see clients. It's we're all trying to fit this in versus it being proactive care in our system. And so I don't think that pelvic floor physical therapists, we work with muscles, right? I'm a PT and I work with muscles. I just happen to work with the muscles in this area, which go through significant transformation and change during pregnancy and postpartum, and then again in menopause. So for the case of you, Jessica, with your C-section, the pelvic floor muscles change in typically lengthen and weaken just during pregnancy. So even if you had a C-section, your pelvic floor changes.
Yeah.
Okay.
Now you have less risk of certain issues like leakage or prolapse if you had a C-section. Vaginal births are more likely to have leakage or C-section. But when you have a C-section, you're more at risk for painful menstruation, painful bowel movements, incomplete emptying, and painful sex.
Incomplete emptying. I am
Yeah.
not sorry, y'all, but like I have to, like it takes me. I'm never. What am I trying? So like I'm peeing, okay, normal sitting down, and now, like at my age, after birthing and all the way, like I have to lean forward and like kind of wiggle to like get
everything
it
out.
all out.
Yeah.
And it's so
Yeah.
fucking annoying
Yeah.
because it's like it's taking me like 10 minutes, not really, but whatever to pee because it's not all coming out.
Yep.
Right.
Okay.
And so that can be related to C-section, that
Yeah.
C-section shelf, where what happens is the fascia, which is like this like slippery layer. You know how you eat chicken and it's like the skin and that slippery white layer and then the
Yeah.
meat? I know,
Yeah.
right? So like, sorry, vegetarian.
Great analogy.
Sick.
Sorry, chicken eaters. But that slippery layer is fascia, and that can get really restricted by a C-section scar. But that fascia wraps all the way down to your pelvic floor.
Mhm.
And so when that gets tight and restricted, it can't release and relax to allow your muscles to open up for your bladder to empty. But what happens, Jessica, is like, say this is happening for you, you might eventually start pushing when you pee.
Oh, I
because you
do.
need
No,
to-
I do that.
Yeah. And that will weaken your pelvic floor over
Yeah.
time. And so you're like, but I had a C-section. Why am I leaking? And I'm like,
Yeah.
oh, because you've been peeing all wrong. But it can be related to your C-section. So, you know, I think what I love about being in this field is it's like you're trying to figure out a puzzle. It's like, what's causing Jessica's incomplete bladder emptying or, you know, not having enough support to insert a tampon or painful sex or whatever the case may be. But we're looking at all of what your experience have been, you know, whether it's surgery or birth or whatever. And then also, what are the muscles telling us? And then we put that together to kind of figure out a treatment pathway. And I love it. I mean, these changes are small that you can make. It doesn't have to be a complete overhaul of your life.
Correct.
To like learn how to massage your C-section scar or how to change how you're peeing.
Yeah. I mean, it's like, I don't even think I knew about, like, I think you saw like on your Instagram or whatever, like Kegels or whatever is the only thing that I feel like I knew about as it relates to like anything down there.
Yeah.
Anything. Like, and I was like, okay, Kegels are to like make your snatch tighter. So like you can feel better for a boy. Like that's like what?
Well, and the problem is something I learned was I don't know if you remember this, Sarah, because it was so long ago that you saw me, but like I thought I was doing a Kegel correctly, and I was actually doing it wrong and making my problem worse.
Yeah,
because
you're pushing out instead of
I was
pulling
pushing
in.
out instead of pulling in, and it's like
you were.
Yeah, but here's
sorry.
the thing. It took me, it's not like I was purposely pushing out.
Right,
It's
I know,
that
I'm
like
doing
my
one
brain
now.
was not communicating properly with the muscles down
Oh.
there. And so it took her like hooking up these little machines to me so that I could see like the contractions of my muscle and be like, oh my God, that's what I'm doing. And it wasn't like I was intentionally doing a Kegel wrong, but it's like, who the hell is teaching you how to do a Kegel right? Nobody's
Exactly.
teaching you that. They just assume you know it. They're like, oh, well, they explain it to you with words, and then it's like you're supposed to know how to do it. But like, it's not that intuitive. That's what I learned from Sarah is like, this is not as intuitive as it looks.
As
and like,
people make it
that's
seem.
where
Yeah.
having a physical therapist who specializes this and can like walk you through it and be like, no, you are doing that exercise wrong. Here's the right way to do it is so helpful because I was making my problem so much worse.
Yeah.
Right. And that's that's not uncommon, Lauren. I think again to your point, like when are we ever educated about this? Like I think when young women have education on periods, maybe they get something on sex, like it depends on where you live or what school you go to.
Yeah.
And it's like, you know, sperm meets egg, baby thing, but I'm like, that's not sex, right? And so, but when are we educated about our pelvic floors? We're not until we start experiencing a problem. But then it's like your pelvic floor is already speaking a different language, right? So when they're like, listen to your body, you're like, I don't even know what my body's saying because I have never connected with this. And now I've had 3 babies and I'm like, what's going on?
Yeah, correct.
So I think this education needs to come early. That's what I always, people are like, what are you going to do after Floored? Or what's the next book you're going to write? I'm like, first of all, I'm going to take a nap for a month.
Correct. That's exactly right. Yep.
And then I'm like, I really want to do something where I can help educate kids younger because I think that we didn't know any better. And like our parents didn't know any better. But now that we have this education, like how do we educate the next generation so they're not completely in the dark about this part of their body and even ashamed of it, right?
Yeah.
Because it's not just for sex. It has so many functions that need to be addressed.
Well, let's talk about that. Like as it relates to the younger generation, like what is the purpose of a pelvic floor for them?
So still a pelvic floor provides support for your organs. It holds in urine and stool throughout the day. It relaxes to empty your bladder and bowels. When you are menstruating, you need to be able to use certain hygiene products. And we have a lot of young women who are not able to use tampons. And they're like, I want to go on spring break with my friends. Or
I don't want to wear a pad.
I'm going to sleepaway camp. And like, what do I do? And I don't know how to use a tampon. One of my most popular reels, a mom friend at our school, she was like, I just sent this to my daughter who's like in high school because I don't know how to teach her how to do this, but you showed how to insert a tampon. So I sent it to her so she could watch it. And then I sent it to all my mom friends because it's like, we're not always comfortable having these conversations or we don't even know how to have them.
We don't even know.
But it's like, we have to because how are we empowering them to care for their bodies? So,
but I think, no, go.
I would say early period education is really important. Also that periods should not be painful. Like periods that are so you can experience some light cramping or discomfort during a period. That can be relieved with like an ibuprofen. But if you're experiencing periods so painful that you are having to miss school, miss work, miss practice, socializing, it's an early indicator of potential endometriosis, which is a disease. And so this can go on chronically for years. On average, it takes 7 to 10 years for a woman to get diagnosed with endometriosis. And then it's a much more severe disease process. So
when you talk about what that is? Because I feel like we all hear endometriosis, but we don't really know like what it is.
That's a great point, Jessica. So during your cycle, the inside of your uterus collects a lining, like it's called endometrium, and it builds up. And then when you have your period, when there's no egg implanted into the lining, you shed. You shed that endometrium, and that's period blood.
Oh, I never did.
Yes.
I didn't know that.
Right. So exactly. This is
I know. I'm telling you, like, I don't know. I
feel like most people don't.
Yeah.
Yeah. So it's the lining that builds up to make your body ready for implantation of an embryo. And when that doesn't happen, when you're not pregnant, you shed the lining. So when there can be tissue that's endometriosis, endometrium-like, that grows on the outside of the uterus. So it's between your bowels, in your pelvis, by your bladder, outside the uterus. So when you're cycling every month and your hormones are spiking, it's fueling this growth of tissue outside of the uterus that creates adhesions because it's not inside the uterus. And it's incredibly painful, like debilitating pain. And so one of the only ways you can diagnose it, it shouldn't be treated with birth control. The only way to diagnose and treat it is surgery. But if you put a young woman on birth control for 10 years, the disease is progressing. And then by the time she gets off of it, because she's like, I want to get pregnant, I'm in my late 20s or whatever, her disease is so far progressed. And that it's like she's in debilitating pain, and now it's a much more severe state of the disease. Endometriosis is one of the primary causes of infertility.
Why?
Because the fallopian tubes can get restricted and adhered from these. Think of it like cobwebs throughout your pelvis, and it's like causing scar tissue. You know how you have that C-section shelf you can see externally? Imagine all that tightness and restriction internally. And that prevents fertility. It creates fertility challenges. It creates painful bowel movements, painful sex, incomplete bladder emptying. I mean, so many things. All this to say, women need to know if they have young children or if you are a young woman that if you're having periods this debilitating, it should not be dismissed because it's an early precursor. It's an early sign of more disease.
And like I have a friend, like I'm specifically thinking about like one of my friends in high school and like that she like really painful periods, like really bad period cramps. And like the go-to was birth control, like at that stage. And so I guess, let's see, that was like 2004 or something. That's right. So endometriosis, I guess like wasn't talked about back then.
I mean, it's still not talked about that often now, but
it's not.
It's 1 in 10 women have it. So 10% of women, menstruating people, which is a lot.
That's
and
it's
just
not.
Not. And doctors will still be like, get on birth control. But to your point, you kind of have to find specialists in medicine. It's like if you don't have an endometriosis specialist, they're not knowing what to look for. They're performing surgeries that like really aren't as extensive as they need to be. So it's no shade on any medical provider. It's just like, they're not getting the training, you know, like even you, like you're not getting training in medical school or residency of how to diagnose or refer out for these issues. So it's just, it's a real systemic problem. And, you know, even when we were talking about postpartum care earlier, that, you know, we don't have pelvic floor therapy automatically after giving birth, which I think everyone should have. But it's like women are going back to work within weeks. They're still bleeding. There's no childcare. There's no resources. So it's a whole systemic issue of how we're supporting moms. And I think the lack of pelvic floor therapy is just one piece of that.
I mean, so I keep saying C-section because that's me, but whatever. Birth. You leave the hospital, go home, you just had a baby, but you have like 2 other ones at home, okay? And then your hormones are all over the place. Like, how does like pelvic floor issues, how does that impact or potentially impact parenting and then mental health?
So that's a great question. And when you were saying the stats earlier about kind of mental health issues like anxiety, depression, and even more severe cases, which Lauren, I know that you see in your practice. You have a higher risk of depression when you have urinary leakage.
Why is that? Like, because what's the connection? Or is it just like, I don't know. Like,
I would say if I had to guess, and you can correct me if I'm wrong, Sarah, but like if I had to guess, like I think a lot of women like live in shame with that and then they don't talk about it, you know, and it's just like this isolative experience. You're embarrassed, you're ashamed. I think we have that automatic reaction that's not rational where we like think it's our fault. We've done something wrong. And usually like if you have a partner that's a man, you know, they don't get it. They're not understanding a lot of the time. They're not like a good resource to go to talk to. So I think that would be my guess is that like shame, embarrassment, feeling isolated because of it. And then it like restricts your activity if you're peeing on yourself all the time.
That's exactly right. I think everything you said is totally spot on. And, you know, we talk about the benefits of exercise for mental health postpartum. And I'm thinking if you're peeing your pants or you feel like something's falling out of your vagina, like you can't exercise. So, you know, postpartum, when you have a vaginal birth, your pelvic floor muscles are functioning at less than 50% strength at 6 weeks. And that's typically when a woman gets clearance to go back to exercise, to go back to whatever you were doing pre-pregnancy, but her pelvic floor is functioning at 50%. So I'm like, you're really doing women a disservice because now they're going to start running, jumping, going to CrossFit. Like, how much do we just want to get out of the house postpartum? And yet, like, you don't realize
your body's not ready.
Your body's not ready, but we're also not helping it get ready.
Correct.
Like, it has just been pregnancy and birth is one of the biggest physical transformations we'll go through in our lives. Yet there is no rehabilitation afterwards. I mean, if you get an ACL surgery on your knee or a shoulder surgery, you're in PT before. You're in PT in the hospital. You're in PT after. You have a baby, a C-section, or a vaginal birth, and you've got 2 kids at home, and you're like, I'm just going to go home. And feed this child and not sleep.
So I'm going to tell this story, and I am throwing my husband under the bus. So
that's what we do here.
But like, because you said ACL. So this is my second pregnancy, okay, with Monroe. I had a cerclage. Anyways, whatever. So my mother-in-law's in town. I'm at Whole Foods with. Did I tell you this story?
No,
I did.
Maybe.
I'm at Whole Foods with Rhodes, my older one, and I'm, push it. And I'm like, Al, something doesn't feel right. So we keep, shopping because that's what we do. And then I, load the groceries, call the OBER, like, on the way home. And I'm like, yo, like, it doesn't feel great. I just want to check my boxes. They're like, come in. I'm like, okay. So I go home, unload all the groceries, because that's what we do.
Right.
And like my mother-in-law is just sitting there. My husband was pulling the weeds out of the ground. He is on the couch with his leg completely elevated because he pulled something when he was doing the weeds. And I'm like, okay, well, I'm going to drive myself to the ER and hope you're better, whatever. And so then go to the ER, call Chaz. So So Chaz, my friend Chaz, comes and sits with me, and they're like, "You're like, you have to deliver, whatever." Rick makes his way to the hospital. You better believe that man was wheeled in on a fucking wheelchair.
No way. Oh my God.
As I'm walking to go pee. And I'm like, are you fucking, what world am I in? And then he tore his meniscus. Guess when he had the surgery for his meniscus? The day after we brought Monroe home from the fucking NICU.
No way. Oh my God.
Like,
that sounds like a nightmare.
I mean, but this is like what I'm saying. So like you hurt your knee and like it's like surgery, like all of that, like here are all these resources and medication. Yeah, a wheelchair. And like I just had abdominal surgery.
Yeah.
And it's like he's in the bed and I'm like holding the kit, like doing all this stuff because expectations are skewed.
Mm-hmm.
Anyway, so that's obviously a very extreme version of this.
But like a standard case of, you gotta be fucking kidding me.
Yeah. Like, but serious.
Postpartum care. I know.
Yeah.
I know.
Yeah.
It's wild. It's really wild. And I think that your story is not an isolated one. I think a lot of people, I mean, I can share this story that when I was postpartum, my first kid, my mom came to visit me. I was living in Dallas, and my husband and I, at 1 month, like decided to go hit the gym. We're like, we have an hour. Now I'm looking back, I'm like, I would have gone to like eat a brownie and go for a walk. Like we were like, let's go to the gym, We go to the gym. My husband's had only coffee and a banana. I'm like doing a spinning class or like just cycling on the thing. I'm not doing a class. And they come and get me. They're like, Miss, I think your husband needs you. And I walk out, and my husband is passed out on the floor.
No way. Oh, my God.
He has collapsed in the bathroom.
Oh, my God.
His face hit the floor. His teeth went through his front lip.
Ew.
And he's missing his front teeth, and he's like laid out. And I have oh my
gosh.
And he drives a stick shift, and I don't know how to drive that. So we had to call the ambulance, go to the hospital. I have a 1-month-old baby at home. My mom is there. We go to the ER. God. I mean, poor guy. He was like, it goes to show you what sleep exhaustion can do to you. He travels for work. So he was traveling, then back with me. And then I'm in the hospital, and I'm like, literally like, I need a breast pump. Like my boobs are exploding. I literally have milk leaking down the front of my shirt. I'm like, no breast pump. Me. This is awful. No, I literally had to go into the bathroom and hand express breast milk.
Oh my God.
And that's like another thing. Okay. And that brings up like a really great point. Like the ER. Okay. I'm like expecting mothers or mothers who just had babies are in there at some point because of someone else or their own. And you would think that they would have like a couple pumps on hand,
Nope.
I know, but that's crazy.
Nope.
That is crazy.
I know.
Crazy.
So it's and you're like, my situation is isolated. I'm like, no. I mean, my husband had a facial surgery and mouth surgery, and I was like, this was my postpartum. Yeah. And then I had a second baby, and I was like, I want a do-over. I want a new postpartum recovery.
Yeah.
We're just overlooked.
Yes.
Yeah. And I mean, he didn't have time off. He was back at work at 2 weeks. So it's like I needed support, and he couldn't even be there because of his work schedule. So it's a really tricky and shitty situation we're in. I will say in the past 8 years I have been in New Orleans, I have seen the awareness of pelvic floor therapy grow exponentially.
But that's because of you, I think.
It's also just the times. I mean, I think that women are getting more proactive in the care that they want. I think that we're more curious and, demanding of what we deserve now.
Correct.
Yeah.
And I think that we have an amazing community of women and moms that are like, no, we want this. And, I think therapists are meeting the demand of what moms want and need. So I'm just happy to be a part of that. But it's been really awesome to see it grow.
Yeah, that's amazing.
And I mean, and to loop it back to mental health, like you just had a baby, your hormones are all over the place. Like, sleep deprivation, all of that stuff. And then if you have a pelvic floor issue, you're peeing on yourself, whatever. And so all of that compounded, you're at higher risk for all of that mental health stuff. And then you can't even like focus on that because the responsibilities are all on you.
You got to take care of the dang baby.
Yeah. But even take that away. It's
Yeah.
like everything else.
Yeah.
It's like the house. It's the, like, do you have to get back to work?
Yeah.
Like all of that stuff. You
Oh,
can't
yeah.
even, there's no focus on you.
Nope.
There's one appointment after birth.
Yeah.
With your
6
OB, is
week-
that right?
Uh-huh. Yeah. And then
And
they're
it-
like, okay, you can go have sex and exercise. Bye. See you,
Yeah.
see
Yeah.
you next year.
There's,
And
yeah.
40% of women don't attend their postpartum visits.
Wow.
Yeah.
I didn't know that.
Yeah,
Because
40%.
of like systematic barriers or because of
Yeah. I mean, think
Yeah.
of it. It's
transportation,
access,
all of that stuff.
Yeah, transportation, access, childcare,
Yep.
Yeah.
work. I
Yep.
mean, if you're
Yeah.
a 6-week visit, you're back at work. Like you're like,
Oh,
I'm
yeah.
not going to go take time off. So
Yeah,
the
lose
one
money.
check-in that they have, 40% of women aren't going. And so I think what, and I love a lot of the medical providers, a lot of the physicians we work with in our community, but the systems make it really tough,
Yeah.
Really
in
tough.
2018, the American College of Obstetrics and Gynecology changed their postpartum care model to suggest a 3-week check-in
Oh, that's
and then
great.
ongoing care until 12 weeks. But
Oh,
I have
that's
not
awesome.
seen any
Oh,
single
yeah.
practice in Louisiana
Yeah.
Yeah.
Who's
shifting
actually
towards
doing that.
model.
Yeah.
Because it's they're so stretched thin.
Yeah.
The
Yeah.
demands. I mean, Lauren, as you know this, like we
Yeah.
both left bigger organizations to work on our own because it's like as a working mom, like we needed to create flexibility and
Yep.
support for the life that we have to be in the medical profession. So the demands are high, and I think the systems just aren't set up to help doctors be,
No.
offer the kind of care that they want to
Nope.
offer either.
That's
No.
100% true.
Yeah. And because, like, also insurance,
Yeah. I mean, it's like you gotta, like, doctors have to churn and burn all day long.
Yep.
They gotta see more and more and more and more patients to get reimbursed. And then the hospital's making them see more patients to drive up their RVUs and all that blah, blah, blah.
So
and
it's
so it's
quality
like
of care
they
goes
can't,
down.
if they have 5 minutes with a patient, it's like, how much can you get done?
Yeah, I don't think it's the way that providers want to,
No,
practice
it's
either.
not.
No.
It's not.
Yeah. So I will say, pelvic floor therapy, a lot of us are out of network, which means we are a cash-based practice. And probably one of the more common questions I get is, why is that?
Mhm.
And, the reason is because we're not the traditional type of physical therapy. So
Yeah.
you're not seeing 3 patients in the gym all at once. It's one-on-one in a private treatment room. It's 1 hour, and it's usually once a week or once every other new week. You're not going 3
Yeah.
times a week.
Yeah.
We give you a lot of things to work on at home. But we also, when you work in some of those bigger systems, depending on where you are in your life, like the burnout is real.
Yeah.
And then I, as a provider, I'm like, I'm not able to offer the kind of quality
Nope.
care I want to offer.
No.
Yeah.
And that's not good for my patients. So
No.
it's a very tricky situation trying to navigate all of that of like, how do we care for our patients and also sustain ourselves in this field?
Yeah.
It's hard to do with an insurance-based model.
Yep.
But does insurance even cover this?
Yeah, so it's
it
billed
does?
as regular physical therapy. So
Oh, okay.
so it's based under physical therapy, but the reimbursement, I mean, sometimes
It's
it's
like,
like $40.
it's disgusting.
Yeah.
Yeah.
It's really, so, and we'd be seeing patients for 30 minutes.
Oh,
which
yeah,
is
no.
not-
I
Yeah.
just didn't know. I didn't
Yeah.
know. All right. I just want to hit the tampon thing one more time before we go. So, like, no, but this is real.
Yeah.
So, like, I put a tampon in. I could not tell you how
to
I did
do
that.
it. Yeah.
Like, it feels right to me.
Yeah.
But, like, I don't
You don't know how to like break
to
it down to
explain
someone.
that to
Yeah.
you and
No.
to do it right or, like,
Or your daughter one day.
or your
Yeah.
daughter. Yeah, Monroe. I would try and be like, I don't know. Like, I don't know. Just don't let it get lost in there. I don't know what to
Yeah.
say.
It won't
Like,
get lost.
Yeah, like, but like I think
If you
it's
forgot,
really.
it won't be lost.
Yeah. I
We've all
think
done that. We pull out 2, you're like,
Oh yeah, and you're like, oh shit.
I've done that before. I've done that
How long
before.
have
I've had
been
2
in
in
there?
there. Yeah, like God.
We've all been there.
Yeah. I think and as it relates to like book number 2, whenever, you do that, I think it's going to be real impactful as it relates to obviously education for younger and parents, but like taking that awkwardness out of like the mother, daughter, guardian, kid relationship as it relates to like vag.
Yeah, and
And
periods.
periods.
And, yeah, because we all women go through it.
Right. So it's interesting because there is for me, but I'm in this field and I live, breathe pelvic floor health. There's no awkwardness for me. Like my kids know, they're like, what's that string coming out of your butt? They're like, why are you bleeding? Does it hurt? Like there's no, and I think it's because my environment is so open. And I mean, there's literally pelvic models around the house. They're like, Mom, you got a new vagina box today. You know, it's like, it's so normal for me. And I don't think it has to be to that extent for most people, but I think a lot of it is we were raised, our generation, to not talk about it, to hide it, to feel ashamed about it, to even feel like it's dirty, to feel like we're broken if something's wrong with it. When I'm like, it's literally a body part. Like if you hurt your back, you don't feel like ashamed. It's just a body part, but we don't see it. And so we don't talk about it and we're not educated about it. And I think my goal with the book Floored and just the Vagina Whisperer in general is to really just normalize these conversations.
Yeah, I think it's great.
Yeah. And even Lauren, to be able to talk to your girlfriend, like that's not something we talk about a lot, but to be able to have those normal conversations so we can get real solutions instead of a brochure to do your Kegels or take birth control. And I think we've normalized the problem.
Yes, that's what I was going to say. Yeah. Like peeing after a vaginal delivery, I feel like moms are just like, well, I guess this is just like part of it. And so they wouldn't ask a friend because they think it's just like a normal occurrence.
Just like what we all go through.
Yeah. And so you don't even know to ask. Yeah. Yeah.
Right. And that's what we've been told. I mean, there are commercials that are like little leaks of just part of being a lady. I'm like, I'm like storming around my, I need to make a reel about this, you know? It's bullshit.
It is bullshit.
But I think it's also, we've been told this. And, when you go to the grocery store, there is an aisle of incontinence products because 50% of women over the age of 65 leak urine. So what starts as like a little leak here or there can become more full-blown later.
Yeah.
It puts you at risk for urinary tract infections and, other things. But I'm like, why can't we help prevent these issues?
Exactly.
Like, why can't we do earlier care for women so we don't get to that point?
Right.
Yeah.
And that's really where I think pelvic floor therapy comes in.
So I think it's great. So when does Floored drop?
So Floored is released on June 10th. I'm actually having an event in New Orleans. I'm very excited about it. This is the first time I'm saying it out loud.
Yay!
I think it's Friday, June 13th at Garden District Books. So
say it again. What books? What store?
Friday, June 13th at Garden District Books, Uptown.
Okay. Yeah.
So it'll be like a fireside chat and a book signing. And I'm so excited. It's my first book event. I was like, I wanted to be in New Orleans. So the book drops June 10th. I'll be in New York that day. But everybody who pre-orders it, you can find it on my website, gets 30 days of free online workouts for your pelvic floor, whether it's strengthening or relaxation or... So if you go to my website, thevagwhisperer.com/floored, it's got all the information on there to order it and then kind of get your free goodies and all that good stuff. So I'm really excited about it.
Yeah,
I can't wait.
Excited.
I pre-ordered it.
And they can also find your website on your Instagram, like link in bio and all of that stuff.
I mean, it's literally like thevagwhisperer.com or thevaginaWhisperer.com. They both go to mine, and my Instagram is the Vagina Whisperer. But, New Orleans is such a special place. Like I really credit being in this community as some of the reasons I've been able to kind of reach so many people because I feel like it's so supportive and I love when people come up to me, they're like, are you the Vagina Whisperer? I'm like, yeah, girl, so it's like, it's just a fun, friendly, great place to work and live. And so I'm really happy to be here doing this work.
Yeah.
Well, we're happy you're here too. Thank you so much for coming on
Sarah.
today.
Thanks, Jessica and Lauren. I appreciate y'all so much.
Anybody can go to the event, right?
Yep, that's right.
Oh, sweet.
Okay,
great.
I'll
see you there.
Okay. See you soon. See you June 13th.
All right.
Thanks, y'all.
Well, thanks,
Sarah. Bye.
Thanks,
bye. Thank you for tuning in to this episode of the Little Brain Campaign podcast.
If you enjoyed our conversation, give us a follow on your favorite podcast platform so you never miss an episode.
Do you know someone who would be interested in this topic? Take a minute to share this episode with them.
Until next time, remember, we're all just trying our best.
See you next week.